So, welcome everybody. Thank you for being here. My name is Gmar Santos, and I am part of the CLAIM program, which is a nonprofit organization that offers Medicare unbiased counseling. And I'm very happy to be here. If you have any questions along the way, I don't mind you asking a question, and I can stop, what I'm talking about and be able to answer any types of questions. So feel free to do that. I know Laura will be assisting with that. So let's get started. We're going to talk about different topics regarding Medicare. We're going to talk about eligibility enrollment. We're also going to cover what Medicare Part A and Part B covers. We're going to talk a little bit about Medigap, or the Medicare Supplement Insurance. We're also going to discuss Medicare Advantage plans and what is Medicare prescription drug coverage. And we'll also talk about some of the assistance programs that are available in Missouri for limited income. Now, who are we? Not sure if you've heard of us before, but we are better known as CLAIM program, but it's the Missouri SHIP. And SHIP stands for State Health Insurance Assistance Program. Now, there is a SHIP program in every state. We are federally funded by the Administration of Community Living, and our grant has been awarded through the Department of Commerce and Insurance. And what we do is offer Medicare counseling statewide and offer assistance in understanding Medicare. So we are here since 1993. So we are coming up to our 30th anniversary of offering services to Missourians. And we're very excited about it. We are connected through the Missouri Connections for Health, which is the name of our nonprofit organization. So we do have other programs under the Missouri Connections for Health, and part of the programs that we have to serve people is the CLAIM program. As I mentioned, we are funded by the Department of Commerce and Insurance, and the grant is awarded through the ACL administration. Very important for you to know, we do not sell or promote any health insurance company or any products. So what you will have when you address or call our 1-800 number is a trained counselor that will offer unbiased Medicare counseling and will try to explain how Medicare works and assist you in any way that we possibly can regarding your health coverage. We do this through our volunteers. We do have a volunteering program that we use to send the information out in terms of Medicare counseling and education. They also do Medicare presentations like this one. And we take all year round, either phone calls or in-person appointments to be able to assist people with their Medicare inquiries. Our volunteers are trained and certified with all Medicare information, so they can give out the proper information to anybody that will need our help. We do have volunteers that are from other partner sites that have partnered with us, like AAAs or hospitals or pharmacies, or other organizations that are also nonprofit that will join the program to offer the service near their area of service. Okay. As for now, we're currently a little below the 300 volunteers, but we're almost to the 300 volunteer statewide group with 180 community partners. And we're moving forward to identifying more partners so that we can have more people assisting Missourians with their needs. Our counselors do offer assistance regarding enrollment and billing if the client would like us to do that. We will offer like different options available and give the people tools to learn and know what options are meets their medical needs. And if they would like assistance first with the enrollment process, we work along with CMS, which is the Center for Medicare and Medicaid Services, and they do give us the authority to do this with clients. We also offer assistance in terms of billing issues. We help understand what is the Medigap, what does it do, how is it combined with Medicare, and we'll talk about this in this presentation. We also explain what are Advantage plans, what's prescription drug plan, public benefits like the programs that I'll be talking about later on. If there is an issue or concern and there may be a need to file an appeal or grievance, we can also assist in that. And if we do have somebody that's is a suspected fraud or abuse, we have an organization that we work along with that we can share information so they can assist that client. So let's go ahead and talk about what is Medicare. Medicare is a health insurance. There are people that are eligible for Medicare. Once they are eligible, either because they turn 65 or they may be under 65 and have disability because of Social Security approving it, they are entitled to enroll into Medicare. People who have end-stage renal disease are also eligible for Medicare, and people who have Lou Gehrig's disease are also eligible to enroll into Medicare. And once you get that card, you will get it by mail. It looks like the one that's shown in the screen. It's red, white, and blue. It will have the client's name. It will have a Medicare ID number, and it will show if that person has hospital, that's part A, or medical coverage, which is the part B, and it will have the effective date. So a few years back, CMS changed the ID Medicare number to this random number because the number that was previously assigned was your Social Security. So just to protect people's identity, CMS just started changing the Medicare ID card from your Social Security as the claim ID number to the random number that combines letters and numbers. So if you do have, CMS should have sent out mails to every Medicare beneficiary, and they should have gotten in the mail a new card like this one that will have your new ID number for you to use. So to be enrolled into Medicare, you should call the Social Security if you have credits through Social Security. But if you work through the Railroad Board, you should call the Railroad Board to go over your enrollment for Medicare. There are some changes, and every year there are changes for Medicare. And I will share the Medicare changes for next year, starting January. So for people that have not got the complete credits not to pay Part A, which is 40 credits or 10 years or more, they may pay a premium. So it could be between $278 and $506, and that depends on the amount of credits that that person may have, and you can call Social Security just to make sure. But if you work 10 years, you may or more, you may have already those 40 credits, and you will not have to pay anything, any premium for Part A. With Part B, and you could pay a deductible that will be $1,600 if you do not have an additional health insurance. So why is that? Let me go back. So original Medicare will cover the 80% of the total cost of hospitalization services and medical services. But if you do not have an additional health insurance that will cover that 20%, then you should be paying a deductible. If you do go to any hospital facility and you become an inpatient. And we'll talk a little bit more about what Part A covers later on into this presentation. But this just is an overview of premiums and deductibles that you may pay for next year if you already are in Medicare. So with Part B, everybody does have to pay Part B premium. But depending on your income, you may qualify for any assistance program, and I will also talk about that later on. Part B for next year is $164.90, which is really good because it's a reduction from this year, which is $170.10. So that was very good to know once we learn about this change. For the new Part B deductible, and this is if you don't have an additional health insurance that will cover that 20%, people may pay $226, and I will elaborate a little bit more about this later on. For the prescription drug coverage, the premium is $32.74. It doesn't mean that you will pay this amount in a prescription drug coverage. You may pay less, but this is the average premium that plans can offer. For Part D deductible, it will go up to $505 max. And I will talk about this later on. And for people that are new low-income subsidy, the co-pays may be from $4.15 till $10.35. Okay, so let's move on. I'm just moving my bar a little bit down. Okay, so if you don't have Medicare yet and you're new to Medicare, you have overall 7 months, which will be your initial enrollment period. Now, the example could be that I turn 65 in March. So that means that my initial enrollment period that I can enroll into Medicare will start 3 months before my birthday month. So that means that in December, I can call Social Security and start applying for Medicare for the first time. If I don't do that, that's okay, because I still have my month that I turned 65, which in this example is March, but I also have 3 months after that to enroll into Medicare. So that will be April, May, and June. So my 7-month period initial enrollment is from December till June. Those will be my months that I can go and call Social Security to enroll into Medicare for the first time. Depending on when you do that, then your enrollment into Medicare will be effective. Now, if you do that the 3 months before, remember you have not hit 65 years yet. So that means that if you still do call before your 65th birthday, your month when you turn 65 will be the effective month that you will start Medicare coverage. If you decide to wait a little bit more, and maybe you enroll into, like, if it's March, like April, then your enrollment will be the month after you enroll. So depending on if you decide to enroll in your 2 last months, then your enrollment will begin 3 months after that enrollment. So that is something that will happen if you do this in 2022, because in 2023, things will change a little bit in terms of when will your effective month be, depending on the time that you decide to enroll into Medicare. And I'll talk about that a little bit later on. But in 2022, let's say that you are still working and that you have an active employment group plan. you can wait and hold on to that enrollment until you decide to retire. So if you decide to retire after, it could be any age, but if you still have an active group employment plan, you will not need to enroll into Part B of Medicare immediately, because that active group employment plan is your primary health insurance. So once you decide to retire, and that active group employment ends, you have 8 months to be able to enroll into Medicare, including the prescription drug coverage part. So some people may choose to enroll into Part A if you don't have to pay any premium, and that's totally okay once you turn 65. But Medicare will not be your primary health insurance. Your active group employment plan will be your primary health insurance. So you can use a special enrollment period if this may be your case after you decide to retire, and you will not have a penalty because of this. So if you do decide to retire after your 65th birthday and your active group employment plan ends, you need to verify if it's a creditable coverage, and human resources from your organization should be able to let you know. And once you start your process of enrolling into Medicare, you will need 2 applications. So the first one would be the CMS 40B to apply for enrollment. And the other one would be the CMS L564, which is for human resources of your organization to fill out. So they let Social Security know that while you were working, you have an active group employment plan to just waive any penalty, okay? Okay, so I want to talk to you about the enrollment periods that will be different from 2023 on. So beginning next year, if you do sign up for the first time on Medicare, during the last 3 months of your initial enrollment period, that coverage will start the first day of the month after you sign up. So it's going to be quicker, your enrollment effective date. So if you decide to enroll in April or May or June, then your effective month will be the next month right after the month you decided to enroll. For general enrollment period, that is like what happens if I miss my window? What happens if I didn't know that I had to sign up for Medicare and I'm already 66 years old and I'm not actively working? Well, you do have a general enrollment period, and this is every year, the same period from January 1st to March 31st. So those 3 months are your 3 months of general enrollment period that you can use to enroll into Medicare for the first time if you missed your window of your initial enrollment, which was those 7 months. Okay. Now, with next year, we will have other options to consider enrolling people into Medicare without any penalty because of special circumstances, like impacted by a natural disaster or an emergency. The state has to be, declared a state of emergency for that. Somebody that's been incarcerated and just got out, or somebody that had Medicaid coverage and lost it. So those are 3 additional special enrollments that Medicare can think about without having any penalty to that client because of those circumstances. Do I have any questions so far? Okay, I will continue. So there are some cautions. If you do have a health savings account with your employer plan, you do need to discontinue those contributions 6 months prior to getting Medicare, if you are older than 65. So the employer coverage only counts to protect against late enrollment penalties if it comes from active or current employment, yours or your spouse. So let me go back with the active group employment option. If you are a dependent and your spouse is the one who's actively working, but you are part of his or her active group employment coverage as a dependent, you can also wait to enroll into Medicare after because of that. So if you do decide to retire, I know there are some options about COBRA, which is a health, which is you pay for the coverage that you had during an active employment period, but that does not count as an active employment plan because you're already retired. So that's very important to know. So depending on how many employees your organization has, you will need to enroll into Medicare or not, because it may be that if an organization has over, I have to move my bar somewhere. Give me a second. My bar is in the way. If your organization has 20 employees or more, then your active group employment plan will be primary to Medicare. So that's very important for you to find out. Not all 20 plus employees need to have a health insurance. It's just a total number of employees from your organization. But if you are, you work in an organization or a company or an agency that has less than 20 employees, then you must enroll into Medicare because the active group employment plan will be secondary to Medicare. Okay, that's important for you to know. Okay. So these are the phone numbers to call either if you are working for an agency or government agency. You will call Social Security to sign up for Medicare. And these are the numbers, but you have a local Social Security office close to you that you can also call and set up an appointment if you would like to do that better. If you do work for the Railroad Retirement Board, this will be the numbers to call for those types of employees. Now, I like this site because it's the Social Security website, and I know they've done some changes into their website, but it's important for you to realize that Social Security will not call you, and they will never threaten you for information, and we will not state that you face potential arrest or other legal action if you do not provide any information. So these calls may be fraudulent, and you should just hang up. So this is some information that we like to give out because, you know, being in that age close to becoming eligible for Medicare, we have a lot of fraudulent calls. So neither Medicare or Social Security will give you a call, and you should hang up immediately and not give any information out, okay? So let's talk a little bit more about your Medicare options. So we have basically two generalized options for people in Medicare. You can stay with your original Medicare, which will cover Part A and Part B, and it will cover the 80% of the total cost of those services. And you do need to add a prescription drug coverage. So you can do that with the companies that offer this type of product, and it will only cover your prescription drugs. Now, what happens to that 20%? You can add a supplemental coverage, which is called more like a Medigap, because it covers that gap that Medicare will not cover. And these are sold by private companies. Or you can select to enroll into what it's called a Medicare Advantage plan. And they do add the coverage for Part A and Part B, and will add prescription drug coverage as well. And they may add some extra benefits. So they will have like a package of benefits inside their health insurance program. Now, do I have any questions so far? I'm just going to go in a little bit of an explaining what Part A covers and so forth, but I just want to make a little stop.
Any questions so far? None so far.
Okay. So what does Part A covers? Part A covers hospitalization services, as I explained before. Now watch out, because you do need to be an inpatient. So when you think of Part A, you will think, I need to be an inpatient, meaning that I went to the hospital and maybe I went through the emergency room, but then doctor realized that it was more serious than he thought. So I became an inpatient with a room that I could stay in. So that will be covered by Part A. Either medical services or psychiatric services, if that comes to the point. It will also cover skilled nursing facility. And let me just give you an example. Let's say like, is there anybody named Robin around? Nobody's name is Robin. Okay, so let's say that Robin walked in and fell, and then she started having a lot of pain. And when they went to the hospital at the emergency room with the x-rays, they found out that she really needed a knee replacement. So she became an inpatient. They did surgery on her and everything went well. And then the doctor ordered skilled nursing facility services, which is a facility that she would go for approximately 2 weeks, maybe more, to get treatment and rehabilitation treatment therapy with, a comprehensive group of doctors and nurses and therapists to recover. That is paid by Part A as well. So 2 weeks come by, she's feeling much better. She's getting therapy and exercises for her knee with movement. But the doctor from the skilled nursing facility thinks that she may need a little bit more therapy, physical therapy, at home. So she will be ordered home health care. And when she's home, she will have the opportunity to get physical therapy by a therapist that will visit her at her house. And that is also covered by Part A. So that's an example so you can understand all these services. Now, hospice care is for people that have an expectancy of 6 months. And this doesn't mean that the hospice service will end after those 6 months. We have had people that are in hospice for 2 years, because there will be a recertification made by the doctor stating that the client's condition is still the same, and the expectancy, it's still maybe 6 months. And it's a unit care that will make the client's environment more comfortable for her transition, or his transition. Part A also covers blood, but the first 3 pints you would have to pay. Usually what the hospitals do is that they ask for donations, blood donations from family members or friends, and that will replace those first 3 pints. So Part B covers medical services. Now, when you think of medical, you think of outpatient. So Part A is inpatient and Part B is outpatient. So that includes like your primary physician, specialist, includes supplies, tests, that's outpatient, mental health services, preventive services like the vaccines or mammograms, or all kinds of preventive services that will help, keep you healthy. And Part B will be able to cover those. Durable medical equipment. like, for example, wheelchairs or mattresses, gel mattresses, or walkers. Those types of equipments, Medicare will cover, and it's the only plan that covers these types of services. There's no other health insurance that will cover medical equipment. It will cover some medications, but it's just, I had a doctor that really liked to put injections because of pain. So I would feel really good afterwards. But if I've had Medicare Part B, that injection that was administered by my doctor at his office is covered under the Part B of Medicare. So it's just an example for you. So when we talk about our patient, you remember the example of Robin. Well, let's say that she fell and she did go to the ER, and it was just a scratch, nothing serious. Medicare Part B will be paying for that because she was never an inpatient. Now, some people may stay at the hospital for 2 days because, they're still having tests done or some other things, but that person never became an inpatient. And when that happens, they should be getting from the hospital a Medicare outpatient observation notice saying that, hey, you are still an outpatient, so the Part B of Medicare will be covering the services rendered throughout the process while you're here. So just be aware. So as I explained before in the at a glance cost for 2022 and 2023, there is a difference between the Part B premium, which now will be at $170.10, but next year it will go down a little bit for $164.90. And every year the Part B premium does change from cost, and it depends. It may be lower, it may be higher. It's been a while since we've seen a reduction instead of being more expensive. So for us, this was great news to hear. Depending on your income, you may be paying a little bit more on the Part B premium. So it can be taken out of your monthly benefit check. Some people prefer to pay it in other ways, like, a bill or, just sending a check. It depends on the preference of the client. And Social Security can walk them through the payment methods. Now, if they do not receive monthly benefit payments, like Social Security, they can be billed every 3 months. So there are people that do want Medicare despite of not having all the credits. They will be billed and they will pay for Medicare every 3 months. For 2023, it will be $494.70 because it's a lower premium. So that's the overall payment for 3 months worth. They can set up an easy pay for monthly premiums as well. So there is an annual deductible that I mentioned back before, and in 2022 it's $233, but in 2023 it will be $226. Now, what is this? This is like example, if you do have original Medicare and starting January 2023, you go to your doctor or have some tests done. Initially, you will be paying out of pocket for that cost until you reach $226. So it's not that you're going to go for your first visit into your doctor's office and pay the $226 at once. You're just going to pay, like, let's say that he will charge without somebody that doesn't have health insurance, $80 for an office visit. So that will be the amount that you will be paid. And then if you have some tests done or you have to go to, any type of service that will cover Part B, it will just add that amount up to those $226. Now, let me stop right there, because this is only for people that do not have an additional health insurance that will cover that 20% that Medicare will not cover. So if you do have an additional health insurance, like a Medigap, or if you are eligible for Medicaid, which is the Mo Health Net health insurance, you will not have to pay any amount out of pocket, because what Medicare doesn't cover, Medicaid or that Medigap will cover. If you do have an Advantage plan, that will be that package overall, you may pay a copay, because these are private companies that will set up an amount depending on the service that you go to. So but it won't be this annual deductible, okay? So you need to be aware that for doctors that you visit, they agree to accept the Medicare approved amount. So they do a assignment. For doctors that do not accept assignment, they may charge you 15% more of the cost, because they do not accept Medicare. So they do have critical access hospitals that had fewer beds, and you can expect a 20% co-insurance that may be based on a higher amount than a larger hospital. But you know, these are special circumstances that you may encounter with deductibles or copays. So let me continue talking about Medigap. Do I have any questions about Part A and Part B?
Any questions? None here.
I know I'm throwing a lot of information out there, so I know it must be overwhelming for you. But please let me know if you have any questions, and I am available afterwards if you want to talk to me, you know, with any specific issues. Just letting you know. So what is Medigap? Now, I briefly mentioned that Medigap is a health insurance that will cover that 20% that Medicare will not cover. So remember, original Medicare will only cover 80% of the total cost, and the Medigap will cover that 20% that Medicare will not cover. People need to be enrolled into Part A and Part B to enroll into a Medigap. And they are designed to cover the deductibles, copays for co-insurances that Medicare doesn't cover. If Medicare doesn't cover a specific service, the Medigap will not cover it. So they are designed to be a combination of what Medicare services will not cover in terms of, you know, cost. So dental or routine hearing exams are not covered under original Medicare. So when we're talking about Medigap and Medicare, I'm talking about the original Medicare. And original Medicare doesn't cover dental work or routine hearing exams. So the Medigap will also not cover those types of services. So if Medicare denies a claim because it's not something that they will cover, the Medigap will not cover it either. So they have to be services that Medicare will cover, okay? They are all accepted anywhere in the United States, because original Medicare, the benefit of having original Medicare is that you can go to Florida, you can go to California, you can go to one of the US territories like Puerto Rico, and you will be covered with original Medicare, and you can visit any medical provider. And if you do have a Medigap as well, that Medigap will cover wherever your Medicare card covers. So Medicare will cover statewide, including US territories, and the Medigap will follow and also cover wherever in the United States including the US territories. So if you want to travel, just think about the original Medicare coverage and, adding that Medigap as an option. Medigaps are standardized. So they are assigned letters like A, B, and it may be confusing because we're talking about Medicare Part A and Part B, but then with Medigap products, you will see like Part A, Part B, Part L, Part M, N, G. So they are products that are designed to cover more or less the copays that Medicare will not cover. And we offer guidance on how to look for Medigaps. Under the Department of Commerce and Insurance, we have the Medigap shopping tool. And our counselors are available to walk you through so you know and learn how to look for best options, depending on your medical needs. So the eligibility with Medigap starts when your effective date of Part B begins. So if you decide to enroll into Part B, let's say March, you have 6 months from March on to view your Medigap options and enroll into a Medigap, okay? If you are under 65 because of disability, you can have a second chance of enrolling into a Medigap once you reach 65. But for people that are 65 or older and they just enroll into Medicare, you do have 6 months after the effective month that you started your Part B, okay? So with Medigaps, we have what is called guarantee issue rights. So that means that once you enroll into a Medigap, companies need to sell any plan to a beneficiary regardless of your health. So that is something to consider. They do need to honor the current price depending on the beneficiary's age. There are some exceptions because there are people that smoke and include like use tobacco or have any, not having any recent prior coverage. And there are some companies that will accept people under 65. There are some companies that will only accept people that are 65 or older. So the Medigap shopping tool guide will really help out into learning more about which will be the best option for the client that's new into Medicare. There should be no medical underwriting, no physicals or health questions asked, and they cannot exclude coverage on services covered by Medicare. So they do need to cover the same services that Medicare covers. The annual open enrollment is not the same for Medigaps. So each person that is enrolled into Medigap will have their anniversary date. So let's say that I decided to enroll in April for Medigap. My anniversary date is April for next year. So if I want to change coverage or I want to change companies, I can do that next year on my anniversary date, but it has to be the same letter that I decided to enroll initially. So if I enroll into a plan G, that is a Medigap, the same letter and product is what I can switch from one company to another, but it has to be the same plan product, okay? Any questions?
No, no questions.
Okay, I will continue.
Okay.
Crickets, I'm hearing crickets.
Sorry.
No, it's fine. So eligibility and enrollment, and I'll try to be more concise because I don't like to read all this. I just want to explain a little bit more on how this works. The policies are issue rated. So you will continue to pay the rate for the age at which you first purchased the policy, even if you're older, as long as you remain with the same company and the same letter policy, okay? You may find companies that offer the same letter, but are less expensive. So you can do that switch as long as it's the same letter, okay? You need to make a careful decision once you start in Medicare if you decide to enroll into Medicare, because you're depending on your healthcare needs and your budget. Missouri is the only state that has the anniversary guarantee issue right to shop for any other Medigap plans for a better price. So you have 30 days before your anniversary month and 30 days after. So if I'm in April, that's my anniversary month, I can start looking in March, and also I have until May, okay? And that only works in Missouri. So let me just keep going. Talk about original Medicare, our A and B. We talked about Medigap, and now let's talk about Part D. So Part D is because of prescription drugs. Everybody that's on Medicare needs to have a prescription drug coverage. So that's where Part D comes. It will cover outpatient prescription drugs that are dispensed in a retail pharmacy. They are sold by private companies, and we can assist into reviewing your prescription drug option plans through the Medicare.gov website using what we call the plan finder tool. Again, our counselors are available for this to go in a one-on-one counseling. We are not in a hurry to answer any questions. We will take the time necessary to help you out in any way we can to make you understand what is Medicare and what are your options out there. So it's not automatic. So you do need to call a specific company that you may choose to enroll into a prescription drug coverage. If you do have Medicaid, Medicaid does function as covering your prescription drugs, but you will still need to add a prescription drug plan because you do need to be enrolled into a Part D plan under Medicare. So that prescription drug plan will cover initially your drug cost at the pharmacy, and Medicaid will complete covering the rest, okay? There are some prescription drug plans that are zero premium for those people who have Medicare and are eligible for Medicaid, okay? We have to watch out that the plans do have a formulary, and you do have some drugs that you need to verify if they are covered under that prescription drug plan. So be aware that if you are looking into enrolling into a prescription drug coverage, make sure that your drugs are covered under and are in that formulary list of drugs. And again, our counselors do assist with this as well. So with prescription drug coverage, and this is another enrollment period, and your eyes may be rolling up and saying, oh my gosh, so many enrollment periods, how am I going to remember this? You don't have to. You can call us and we can go and walk you through this. It's the same when you're first eligible for Medicare. So you have those 7 months to enroll into a prescription drug coverage. Now, if you retired, then you have 63 days after your retire date to look for a prescription drug coverage that will best meet your needs in terms of drug coverage. Either you retired or you lost your creditable coverage, you're moving out of current plans coverage area. We have people that lived in Arizona and moved to Missouri, so they have a special enrollment period because they moved from one state to another. So plans are different in each state. So Medicare will allow a special enrollment period for these people to enroll into a plan that will work in Missouri. If they move in or move out from a nursing home, if they just approve extra help, which is an assistance to cover prescription drug copays and costs because of limited income, because they may have left a Medicare Advantage plan within the first 12 months of they enrolling into Medicare, they can go back into original Medicare and enroll into a prescription drug plan. If they were, outside of the US and they just came back, they do have a special enrollment. If they just got released from incarceration, or CMS, which stands for Centers for Medicare and Medicaid Services, granted a special enrollment because of emergency circumstances. So costs do vary by year, and this year the average is $33.37. That's an average amount that you may pay if you decide to enroll in a prescription drug plan. For next year, it will be $32, I'm sorry, with 74 cents. And the annual deductible will be no more than $480. You may not need to pay this. It depends on the product that you decide to enroll in. And it depends if you have Medicaid already or other additional assistance. It does depend as well on the drugs that you take. So if you do take generics, you may never be in the need to pay this amount because of the lower deductibles or copay that generic drugs may have. Again, our counselors are available to walk you through this and for you to understand what you may need. If you do enroll late because you missed your window, you didn't know about it, you may pay a penalty of 1% for each month that you did not enroll into a prescription drug plan. But if you do qualify for extra help, which is an assistance program that Social Security has, you don't have to pay any penalty. It will be eliminated, okay? If you do have Veterans Affairs benefits, you may not need to enroll into prescription drug coverage because Veteran Benefits has prescription coverage, and that is accreditable coverage under Medicare. So people don't necessarily need to enroll into a prescription plan if that is the case, okay? Any questions?
Yes, we do have a question.
Yes.
Can the companies change their formularies from one year to the next?
Could you hear that, or I can repeat it?
So are you asking why the plans change the formularies from year to year?
I'm asking if I have a plan and all of my medications are in the formulary, next year, may they exclude part of those same medications
They
from
can
their
change.
formulary?
They can change the drug list. Every year they do that. All plans do change their drug list in their own formulary. That is why it's so important to review your current plans to make sure that the drugs that you do take will be added for next year's formulary list. The Medicare Plan Finder is a great tool for you to make sure that that they are going to include or not your current prescription drugs. And you can find out as well how much will you be paying out of pocket for each drugs. You will know if your current pharmacies will still be inside their network and how much you will be paying for each drug overall, and how much you will be paying out of pocket for each month for your drugs. So it's a great tool to do, and you know, we can assist you. You can also call the plan and ask that question. If you're already enrolled into Medicare and you do have a health insurance coverage for prescription drugs, you may call the plan. But I like to go over the Medicare website because, you know, it's a trusted source. I can see for myself how much will I be paying. I can see for myself if my drugs will be included into my current health plan. And, you know, it's a good option. But if you'd like, you're already on Medicare, you can ask the plan directly. Again, our counselors are here as well to help you on that search. For people that are already enrolling to Medicare, they do have until December 7th to make a choice in enrolling into a new plan for 2023 or staying in their current health insurance if they would like to do that too. Did I answer your question?
Yes.
Yes,
Okay.
thank you.
All right. Okay, so Medicare Advantage plans are like a package, it's like a combo. I don't know, I like Steak and Shake. And they include like a combo of, you know, chicken and fries, and they have either tea or a soda. And then Texas bread. So they include all of that into a combo, and the Advantage plans are like that. They are private companies that they have contract with Medicare to include into their package Medicare A, Medicare B, prescription drugs into one health insurance plan. They may add other benefits, like some plans that I know can cover out of the counter medications at the pharmacy, or some others will cover transportation. That's just an example for you. And those are extra benefits. The thing with Advantage plans that you do need to be aware is that they do work within a network of providers. So if this strikes your interest, please make sure before you do enroll is that they will cover your service area, because they work geographically and they may be limited by that. They do have within a network, make sure that your providers, your doctors, specialists, do accept the plan that you're looking at. I prefer for people to call directly to their providers. That's the most trusted way that I can think of. Just making sure that next year when I decide to continue services with the same Advantage plan, I will walk into my doctor's office and he will accept my health insurance. Drugs are also something that you need to check out with Advantage plans. They will work with a formulary list of drugs, and they will change from year per year. So just make sure that your current drugs are also part of the plan's formulary. We cannot switch the Advantage plan with original Medicare. So if you do enroll into an Advantage plan, your Advantage plan will only work in Missouri. It will not work in California. It will not work in Puerto Rico. It will not work in Florida. Just for you to know. Okay, so you do need to be enrolling to Part A and Part B to be eligible to enroll into an Advantage plan and live in the plan's coverage area. Okay. Again, the annual open enrollment period is from October 15 through December 7th. And the plan that you will decide to enroll in will begin January 1st. We do have enrollment periods, and I know we are coming a little bit on the time, and I want to respect your time. General enrollment, you can switch from January 1st to March 31st. If you enroll into a Medicare Advantage plan, you can switch to another Advantage plan if it doesn't work for you. You can switch back to original Medicare and add a prescription drug coverage. And that change will be effective the first day of the month of the following action to change. If you enroll for the first time, you have 12 months as a trial period that you can return to original Medicare at a prescription drug plan and purchase a Medigap, which is part of those guarantee issue rights during this 12 months. Again, this is a caution that we always want to add. Check your providers, check your drug coverage and cost, and understand that every plan has a specific benefit, and you need to know what your medical needs are, what your needs are, and think about those when thinking about a coverage with Medicare. Again, this is for the employment insurance that we spoke initially about the active group employment people. They do have 8 months after they decide to retire to enroll into Medicare, and they can sign up without a penalty. You may select COBRA, but it's because you're still on those 8 months. I would not recommend stay with a COBRA because it will not function after those 8 months as a secondary health insurance. You should enroll into a Medigap prescription drug coverage, or if you decide to enroll into a Medicare Advantage plan. So just make sure that it will cover your special needs. Limited income subsidies for people that, because of limited income, may qualify for what is called extra help. And they may qualify for zero premium for prescription drug coverage. And it helps covering co-pays, co-insurances, and they can change plans quarterly. Either if they're in prescription drug plan, they can change quarterly into an advantage plan that adds prescription drugs. And usually these are people that are already enrolled into Medicaid, which is the limited income plan in Missouri. We help with that application. We help in discovering if you're eligible for this type of assistance. So you can give us a call. We also offer assistance into enrolling people, applying people for Medicare Savings Program. And this is for people that also have Medicaid. There are state programs that will help pay that Part B premium if you qualify, depending on your income. So we can go over that with you and see if you qualify for any of these states' programs. The Mo Health Net is the Missouri Medicaid, and it will act as a supplement to Medicare. So if you are Medicare already, you qualify for Medicaid. Medicaid will function as the Medigap for Medicare, and it will cover those co-insurance and co-deductibles. Okay, and this is the table for the income and resources. This year, all years, this guidelines do change, but this is our most accurate guideline for you to use if you may think that you may qualify if you already have Medicare. And again, you can call us and we can assist you with this, and we'll walk through every step of every information that you may need. So the SMP program stands for Senior Medicare Patrol, and this is the organization that I was talking to you about at the beginning of the presentation. They handle Medicare fraud and abuse, so they have great information to help people avoid this. But if you think that you have been a victim of fraud because of Medicare, you can call them and they can assist you what to do. We offer assistance with the Medicare.gov website, and we can help you into creating an account. It will help you see your Medicare summary notices, see what plans you're eligible for and you're enrolled in, see your drug list, and if you other records of your Medicare Part B status. So again, this is more that you can think about if you need our assistance. Now, it's important for you to understand that your general enrollment period, if you miss that initial enrollment window for Medicare, is January 1st and March 31st of every year. And currently you are under the open enrollment period, which is for people that are already on Medicare and may need to review their options for next year. So you have until December 7th to do this. Remember, Medigaps work differently. So they do not work during the open enrollment period unless your anniversary date is one of these months, okay? Finally, we always welcome people that would like to serve other Missourians with Medicare coverage. We're always wanting counselors that will be available to do this, and you are very, very valuable to us, and we want to make sure that you have the most accurate information available. So with that is the end of my presentation. But if you do have any questions, I'm available to answer them.